Jabe, and he is so ready to have a conversation with us. First and foremost, we'll get to find out how he is faring on. Welcome to the studio, Dr.
Thank you so much.
How have you been?
Good, pretty busy. And nowadays we're having more and more people. I think they're getting to know more about Cure and our services both in Nairobi and in Kijabe, and all the mobile clinics that we do every week in different parts of the country, focusing on children with orthopedic conditions. Thank you so much for hosting me tonight.
You're most welcome. And so tonight we are having a conversation revolving around the common work-related injuries. And I know at some point you also let us know how to avoid them. And as time allows, we also look at treatment, because after somebody has had some injuries, they need some form of treatment. So we carry on and give an opportunity to the listener. In case you'd like to ask a question, you are welcome to do so by sending your question to 20933, that is 20933, or WhatsApp on 0717400555 across our social media platforms at Hope FM Live. And tonight we are live on Facebook as well as on YouTube and on X. Yes, you can track with us as we carry on with this conversation. And so, Terry, what are some of these common work-related injuries? You can categorize them, and then we'll go one by one and how we can ultimately try to avoid them.
Okay, so first, all over the world, it's the number one is back pain. This is the most common work-related issue that is most of the time non-traumatic. It can be, especially for the people that are working in the office, almost half of them during the life they're gonna experience some form of back pain. That's the number one. Then other common problems are sprains and or tears of the ligaments. So the most commons are the ankle ligament. That's not just only for the people that are working outside, but that's a common injury even when you walk. If the let's say if the floor or the terrain is not even, you might just trip and have an ankle sprain, which is one of the most common injuries. Then accidents for the drivers, for the ones that are commuting every day with any form of transport. That means dislocations and fracture. They are not necessarily, those are work related for like lorry drivers or people that are traveling as a work, but it could be injuries related to people that are getting to the job. Most of us are not lucky enough to walk to the job, but it's still considered a work-relating issue because in Europe, for example, work starts when you are commuting from your house to the place of the job. Of course, it shouldn't be more than 30 minutes, otherwise, it's not counted. But an injury that comes on the way to work is considered a work injury, or getting from the work to the house, and this is related to the road traffic. So other common issues are shoulder pain. This especially when you start aging a little bit, when you are around 50s. That is not necessarily traumatic. That could be also an overuse injury, especially for the workers that are using their shoulders and their arm above the shoulder, because you are basically putting at risk all the what is called rotator cuff muscle, that are the muscle that we have around the shoulder, that contain the shoulder, and sometimes it could be just a small tear, but it gets worse as you are using or overusing your arms. Um, Others, let's say less, and this is less common in people that are not doing a kind of a hard job, because like that could be meniscus tears and ACL, the cruciate ligament of the knee. Those are a bit less common. Other very common injuries or work related, let's say, are the carpal tunnel syndrome, or the cubital tunnel syndrome, that is on the inner part of our elbow. That's especially on those guys that are using a lot the computer, and now it's becoming more and more common, even in young people, because of position. And the other issue is the epicondylitis, which is called tennis elbow, but not necessarily on the people that are playing tennis. Usually, it happens on the place where you on the arm that are using the most, on your dominant arm, and is not related absolutely to tennis, but it was and it is still common in people that are playing tennis recreationally, because actually, especially in your dominant arm, you are using those tendons that are the extensor tendons, or the forearm, and it's a kind of another overuse injury, and it's kind of a tedious issue because it lasts long. I mean, most of those issues are not really big, but they're really bothersome, especially for people that are going home, and you when you get back from the job, now you start taking care of your children. And now, if you have those kinds of pain, then you might not be able to hold your child, because you have pain. Then I would say other issues are less common, like maybe in people that are running a nursery, because of holding a lot of the kids. It's a problem on the dorsum or the thumb, called de Quervain syndrome. Basically, there's an inflammation on the extensor tendons of the thumb. It makes you most of the movements with the thumb very, very painful, and those are difficult to and long problem to treat. Not all of those people will need surgery, but a good number eventually will get. And then hip problems are a bit rare, especially in the younger population. Then we can talk about arthritis, which is not necessarily related to the job. Sometimes it could be post-traumatic. Some people that had fracture during their life, now they're developing arthritis because of a bad fracture that maybe they had some years back.
So you have given us a sphere there of work-related injuries, especially when you're on your way to work, when you're seated. For most of us, we sit, but there is the issue of posture when we are
Mhm.
sitting, and overuse of the thumb, the hands, the ankle, and you've also talked about back pain and shoulder pain, depending on the kind of work people do. And so, as we get to see more about these common injuries that we get during our work time and all, are there some that are serious, or all of them are serious to the extent that they need some form of treatment? And if there is treatment, what needs to be done whenever one sees that they have either of those that you have just mentioned tonight?
Okay, so for example,
Mhm.
most of the time for the back pain, there's some, as you were saying, ergonomics that can help. Like, but unfortunately, most of the places they don't have such a nice chairs like here, and they definitely help someone that is working on a desk. To have proper equipment, the height of the desk, proper chair that can go up and down, some armrest, a good backrest. Those are really helping in terms of the work, because the more you're comfortable, the less likelihood of having any injury related to the job, and the more likelihood you're gonna like your job. Because if you're not comfortable, then you start having positions that are really weird. You try to stretch yourself, and then that's not good. What is advisable is, like, at least every 45 minutes you should stand up, do a small walk, even around the office, just to stretch the muscles, because you can't stay for 8 hours sitting. And also because what happens is that you forget, like, you might think about your back just when you have pain, then you put your back very much straight. Then at a certain point, when you keep writing on the computer, your back will just start leaning forward, and then it's not the right position. Then you suddenly remember, and it's a cycle. Then at a certain point, you'll just forget about it. And the other thing is that it's advisable for everyone, especially for the ones that are having back pain, to walk at a good, like, what is called, like, fat burning speed, which is kind of a walking at around 60 kilometers per hour, which means not running but not walking slowly, something in between, that allows you to burn fat, and to keep at least your weight, so that the back pain is much less likely to happen. Eventually, most of us will experience some form of back pain, especially the ones that are doing hard job, like even the ones that are, transporting cement, like those packets of cement are quite heavy, and people are maybe throwing from the lorry in Bilimbili instead of 1 month to Arakisha. So just to make it faster, because timing is money, and but then you hardly come back from such an injury, for especially for the ones that are in. I don't know about the law in Kenya, but there should be some limit on the weight that in a normal job you could, which is usually between 20 and 30 kgs. That's the maximum that should be allowed, because otherwise you're gonna have overuse injuries. Like, if all the, like, for the maize, if all the sachet that you have, those boxes are 60 kgs, that's not human. That's not. I know that people are strong, but that being strong will lead you to eventually to back pain, and to suffer, just because when you were young you overused yourself, and now you are crying because you cannot go back, and you're not strong as you were before. So that is the number one. So solutions for that, most of the time, daily physiotherapy, but even exercise. Let's say no, physiotherapy helps every now and then if people have a wrong posture, but most of the time it's just to remember daily exercise to keep the back healthy. Do not be on overweight, because it's like you are carrying like you're putting the weight that you want on a lorry, but you have a Vitz or a Paso, so that's not gonna happen. The shocks are gonna get rotten. So the same happens for our back. If we overload our back, that is gonna give us chronic issues. So those are our health and lifestyle makes a big impact on such a thing.
Yes, you've talked about back pains, because that's what many people share with us here regarding the health of their bones, saying that this is the area that they really, really are being affected. There's also the knee injuries, which occur in people who are working, probably having poor footwear, and you talked about the issue of the ankle as well. So, what are some of the things you can tell someone who finds himself or herself with the knee injuries, and of course, telling us the risk factors of not, getting or handling the situation, so that you may not go to the extent of probably having some sort of surgery and stuff.
Okay, so being a pediatric orthopedic surgeons, we can prevent most of these issues when the children are growing, because the most common thing that can cause premature arthritis, even in a lean person, leave alone the people that are overweight, for the same thing that people can have back pain, they can have knee pain because overloading the joint by being overweight or obese. So the other thing that is very important for the knees is the alignment, what is called coronal alignment, which means that if you look the person face to face, if they align their knees, if they have knock knees or bow legs, this eventually, because your weight is not proportionate, so there's half of the joint that receive most of the weight and the other half not as much, so it's not balanced. So that can cause premature joint arthritis and pain. So if when the children are smaller, let's say below 12, up to 12, 13, maybe 13 for boys and 11 to 12 for girls, because boys, they grow up to 16, usually the skeletal maturity reaches at 16. Girls, they reach skeletal maturity usually 14, like 2 years before. But so if you can take those deformities, you can correct them using a small plate that can avoid osteotomies, which means cutting the bone, put it straight and putting a plate. So you can just take advantage of the growth of the child to stop selectively one side of the joint, so that the leg, by the time you remove that small plate, is going to be straight. So, and that doesn't need plaster. You stay away from the school usually 3 or 4 days because of small pain. You can resume sports in 3 weeks. So it's a very nice process that has helped a lot since the 90s, and it's working pretty well. It avoids a much longer surgery than when you are an adult. So alignment of the joint, especially of the knee, it helps a lot to prevent or to delay as much as possible the joint arthritis that will need a kind of a replacement or any other procedure that needs a bigger surgery. This is something that, as pediatric orthopedic surgeons, we can prevent with a small surgery when the kids are smaller, so that they avoid further issues when they are when they're older. Of course, you can even do the surgery later on, but it's a much bigger surgery that needs more rehabilitation and time to get back into shape. So before reaching skeletal maturity is better to reach out for such issues. So knee issues are easily treatable, especially in children, not unless they had a trauma or an infection. That's much more different. But children that don't have like a bony dysplasia, let's say they have a metabolic issue, but they just have the knee that goes a bit into a knock knees or a bow leg, that can be helped very much and delay further issues when you're older. And especially, let's say for the mechanics, they kind of overload, because they most of the time they kneel, they have to kneel, and so in such a specific job, now they can get different injuries from the ones that are doing more sedentary job, like meniscus tear. Because they have to bend their knees many times. So there are some jobs that unfortunately you cannot, when you look at the car, you have to look it from below. So there's sometimes if the issue is not that big, you won't put it in the place that you can go like kind of downstairs and look it from bottom up, but you just go under the car to look at it, or you kneel and you look at the issue. Those are shortcuts, I understand, but those in the long run, they give like worse problems. But I can understand that not everything is feasible during a job. Yeah.
All right. Thank you. Tonight we are seeing Dr. Federico from AICQ International, and he's giving us insights regarding, the health of our bones, and having given us some bit of highlights there regarding work-related injuries and what we can do. And so we still invite you to send your questions, because in the next hour we'll be delving deeper into them. Probably you have experienced some of these injuries or more, and you need more clarification on what you need to do in case you have sustained such injuries. Get in touch with us on 20933, or you could WhatsApp on 0717 400 555. At the top of the hour,
Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope?
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website, www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I broke my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even midst of the what?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website, www.hopemediakenya.org. Listen and live.
Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope.
Ligethood, and she was part of that particular group. And some of her well-known songs include that one, yes, as well as Hosanna, Man of Sorrows, and King of Kings. And her song writing often reflects the themes of praise, worship, and the Christian faith. And Ligetwood has been recognized with various awards and nominations for her contributions to Christian music. And this week on Breath of Heaven, we were celebrating her. And it is now 13 minutes past 8. Welcome to the second hour of Breath of Heaven. And as promised, we continue with our conversation regarding the health of our bones, and more specifically, looking at some of those common injuries, work-related injuries. And I've seen a number of you already sending your questions. Daktari will be answering them right now. And Dr. Federico is with me tonight looking at these questions. And so, Dr. we'll look at some of these questions as we carry on with this conversation from a listener who is asking, part one, we'll be praying with you regarding your business during our prayer time. But you're asking, you say, my right leg, the big toe, has a sharp pain. I haven't knocked or hit anything. Kindly ask the doctor what could be the cause. I am 65 years old. This is a lady, Abigail, 65 years old.
Okay, so it's pretty frequent in ladies to have what is called a hallux valgus, which means that the big toe basically deviates, and it gets toward the second toe, and that creates in between the toe and the other bone that is before called metatarsal in the bone, a bunion, like a swelling. So there's in the medial side, so in the side that is free, that is rubbing on the shoe, can get what is called an inflammation called bursitis. So there's a bursa. There's a small place where there's some liquid that can get inside, inflammatory liquid. So it swells and it gets painful. So that's pretty common, especially in ladies, especially if there's a deviation of the big toe, and that's not traumatic. There's nothing that, and especially if those ladies are using high heels, that can exacerbate the pain. So this is hardly to say that is work related, but it's pretty common after a certain age, especially in ladies that have this deviation of the big toe. So that could be the pain, the bursitis, so the swelling that there is on the medial side of it. Usually, it can even try to put some local anti-inflammatory drugs or take anti-inflammatory drugs like ibuprofen, or if the pain persists, then the other thing I would suggest to do is an x-ray, weight bearing x-ray. So this is very important. Most of the x-rays that are done, we just had a foot and ankle camp with two surgeons that came from the US, and also Dr. Ezekiel Oburu, that is a foot and ankle surgeon in Nairobi. He came with us. We like to cooperate with other doctors, as we believe that there's not private and public patient. All patients are the same, because it is our duty to do our best for all the patients that we receive. So it doesn't matter. It's not a matter of being rich or poor. It's a matter of being a human being. So as a Christian, we should treat everyone the same. Love the others as we love ourselves, or even more, I would say. So for all the patients that we have, we are trying to be dedicated, especially in these foot and ankle issues, because there's not many doctors that are still kind of super specialized in such a thing. So x-rays done without the foot to bear weight, they are useless if someone is a foot and ankle surgeon. So that's the basics. So if someone goes to the center, please refuse to take pictures while your foot is not bearing weight, because that is not giving us, as orthopedic surgeons, a good pictures of what is happening on your foot. So please, if you are gonna get an X-ray because the pain continues, and you have a deviation of your big toe, get a weight bearing X-ray. Please pretend it, because it's your right. It's not good to do more X-rays than necessary, though the risk of getting issues because of X-ray is very low. And as orthopedic surgeon, we are exposed to tons of X-rays, and we are not getting work-related issues because of using protection and stuff. But the minimum the radiation, the better it is. So please, if you're gonna get an X-ray, please tell the radiology technician, I want to do this X-ray bearing weight, because the surgeon told me that without bearing weight is completely useless. This is not unless someone has an injury that can bear weight. But in such a case for this lady, I would suggest, so if the pain persists, so that we can help better and we don't have to repeat. You don't have to pay another X-ray, and it's not your fault. I mean, people should be informed before they pay for something, so that everything can be smooth and we can help better.
All right. Thank you, Dr. Let's look at another one here from this another lady, and she says, what can I do, or what can one do when the leg from the hips, from the hip pains on the sciatic nerve? And another question, how can we help one whose bones were cut, both ulnar and radius? Those are two questions.
Okay,
Yes.
so for the first question, first, if the pain is located on your sciatic nerve and is not going away, so the advice is usually there's a nerve root on the back that is being pinched, so there's a disc. So we have the vertebral bones, and then in between there's some jelly material. Those are the discs that are kind of a shock absorbers, like the meniscus in the knee. So basically, some part of this material that is in between the two vertebrae, in between the two bones, can pour behind and kink a nerve that is passing by there. So this could give you this that is called sciatica, or sciatic nerve radiculopathy. So that is visible usually by doing an MRI without contrast of the lumbosacral spine, and this will help definitely to understand the issue. Most of the time, those things they don't need surgery, not unless you cannot wiggle your toes, or you cannot, let's say, dorsiflex, which means pull the ankle up. So that's a thing that can be really dangerous if not treated, or if not taken into consideration. So to treat it, so the first step usually is anti-inflammatory, or sometimes we use betamethasone cortisone injections, but not every time. Or there are some drugs like gabapentin that are helping the nerves to relieve the pain. The other option, if the pain is not going away with all drugs that we are using, there's some localized, like X-ray. Someone does it CT guided, but anyway, injection of cortisone where the pain is located, where the nerve is hit, so that basically it resolves the inflammation and the pain goes away, the radiculopathy goes away. The last resort that we don't really like to use it, but sometimes is very much necessary and it prevents further issues, is the intervention. So doing a discectomy, or removing that part of the disc that went and touched that nerve root, so that the nerve resumes its space in its dimensions, and the pain goes finally away. So those are the three treatment from zero to the highest treatment. So, but don't worry, most of the time it's just medical treatment is enough, or injection on the back done usually by a pain medicine doctor, which is usually an anesthesiologist. Yeah.
Did you look at the second part where once bones is cut both and ulnar and radius?
So it depends at the level of where is cut, because unfortunately up to now the prosthetics that we use in the lower extremities are much more advanced than the upper extremity, or let's say affordable, because there are some prosthetics that can be connected through the muscles, and then basically if the muscles are stimulated, or the muscle give the stimuli, and the prosthesis can move the hand and the wrist in patients that have either auto amputation or post-traumatic amputation, but those are quite expensive. And here I haven't seen them yet, especially the myoelectric prosthesis. What we've seen and what we do also are cosmetic prosthetics. So basically, but they are not functional. So those are just for cosmesis. In some cases, if the bones are big enough, you can, if the amputation is close to the wrist, what you can do is to create a space between the ulna and the radius, between those two bones, and basically it creates a pinch in between the two bones, so that the person or the child can hold like a letter or a pen in between these two bones. Though some people prefer rather a cosmetic prosthetics rather than doing such a surgery, because aesthetically some people, they are not happy of such an operation. But if the auto amputation, this sometimes can happen in kids that have amniotic band or children that have focomelia, so that are born with shortened limbs or auto amputation, let's say. So if the amputation is almost at the elbow, there's nothing much that it can be done apart from those very fancy prosthetics or cosmetic prosthesis.
Right. And I hope that helps that listener. And we carry on. This is a listener who is asking, saying, please ask Daktari, how much will it cost to remove a metal plate on my arm? A rough estimate will be appreciated. Saying ORIF or ORIF, yes, was done 2 years ago and it's becoming painful. This is from a listener. His name is Wilson from Dagoretti.
Okay, so usually it depends on the age, because if it's less than 18, in cure with NHIF, the patients won't pay anything. In other hospitals, if NHIF approves, it's I would say it should be less than 10,000 shilling to be added. Though if they are not painful, but the patient said that it is painful. We've seen even back home in Italy patients that were done ORIF with open reduction internal fixation, which means that you open the fracture and you put a plate or a nail or whatever. That's internal fixation. The follow-up of 30, 40 years, they kept the plate. We are talking about the forearm. They don't necessarily need to be removed. But without NHIF, roughly estimate, I would say 100,000 shillings, because it's a day surgery. You come at the same day, in the evening or the day after. If the pain is much, you can be discharged. So it shouldn't be that. But if the plate was there 2 years, I would suggest you, if you don't NHIF, to open NHIF, because it's going to be much cheaper and it's going to help you much more than rather than paying 100,000 of shilling cash. So that would be a better way. Yeah.
Thank you. I hope that helps, brother there, Wilson. All right, let's look at another question here. Yeah, this is from Lizzie, saying in the year 2018, I had a road accident and a metal plate was used to fix a fracture on the bone below the knee. Since then, I have had a swollen knee and the part above the knee is always swollen. Of late, the swelling has continued to increase and occasionally with pain. What should I do?
Okay, so if you have a plate on the and the fracture is healed, what can be done to avoid? Because maybe in the accident, what was visible was the fracture on the tibia. That's the bone below the knee or the patella. But the patella, the rotula, the patella is unlikely to be put on a plate. So most likely what you're talking about is the tibia, the shin bone. So the best would be first to remove the plate. And then, because maybe the problem does not come from the tibia itself. Maybe the fracture is already healed and there's no problem. But sometimes when you have a fracture of the proximal tibia, so let's say the part of the shin bone that is close to the knee, you might have had also a ligament injury of the knee. Maybe an ACL, anterior cruciate ligament tear, or a meniscus tear, or whatever, posterolateral corner tear. We can talk about many things, but the thing is now, to make it simple, it's better to remove the plate, and then once you remove the plate, you can do an MRI of the knee, so that can tell us which is the problem. Maybe the problem was there already at the time of the accident. It's difficult to prove though, and because it was not treated, now the knee keeps swelling and the problem keeps coming. Why is safe to remove the plate? Because not unless it's specifically written on the hospital that did the operation that the plate and the screws were amagnetic, which means they don't attract magnets, then it will be very risky to do a magnetic resonance imaging, so an MRI, because this can cause issues this is a contraindication for an MRI of the knee. So I would suggest not, unless you have clearly written on the discharge summary that the plate and screws were magnetic, please go remove the plate and then get an MRI to understand where is the problem, so that it can be treated appropriately, because most likely you had a ligamentous or a meniscal injury at that time that was not treated, and it needs to be treated.
Right. And we'll still carry on with more of your questions regarding the health of your bones. I see them coming through on 20933 WhatsApp, 0717 400 555, and across our social media platforms at Hope FM Live.
Been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it becomes better, and I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on leadership forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even midst of the what?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website, www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it becomes better, and I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on leadership forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the what?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website, www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I broke my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the what?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or direct.
It is now 23 minutes to 9 o'clock. We are still looking at questions regarding the health of your bones, and helping me tonight is Dr. Federico from Cure International. And of course, questions are coming through fast and furious, Dr. and we'll be looking at them even as they come through, and then a little later on we'll have a conclusion of what we've been discussing, especially revolving around work-related injuries. But now let me look at this one here, and this is Mobi from Tasia, and saying, my 13-year-old has some swelling right below the knee on both knees, rather on both legs, that just appeared weeks ago. I am told it's normal for his age, and Google confirmed it. Ask Daktari if it's true and how long will that be.
Okay, so that depends. So the most common thing, it's called, especially for children that are playing sports like basketball, volleyball, football, so which means most of the children, I hope, it's called Osgood-Schlatter disease. So it's a patellar tendonitis on the insertion of the tendon that is in the interface between the tendon and if I don't know if someone is looking at it. So basically, where the patellar tendon is inserting into the bone, that's where people have this kind of tendonitis, an inflammation of the tendon at the interface of the tibia, so the shin bone. So it swells. It can swell. Usually they have more pain on one side than the other. Usually it starts as pain after the match or whatever the game it is. Then if the child keeps going on, it is a pain that even during the match or the training, and then if it's not treated, it becomes also difficult or painful to walk. Unfortunately, Google can't tell you, because Google can tell you what you're looking for, because you give your own thinking and then Google goes towards that. So otherwise, everybody could be a surgeon, everybody could be a presenter, everybody could be a cook. It's like I say, I can I can look at the recipe of a very fancy hotel, a 3-star Michelin dish, and I can make it. It's not true. Google can tell me the ingredients, but I can cook the dish. The same as I can try to see how a surgery is done, but if I'm not a trained surgeon, I cannot make it. I can look at 2 million of different diagnoses of the thing. Google can tell all the 2 millions, but Google cannot make the diagnosis because you need someone that has seen that before and has worked on it before, because it might be something else. So my advice is to see an orthopedic surgeon. We are specialists in that. We are pediatric orthopedic surgeon. We can tell you, yes, most likely is this, but it might be other things. That's the most frequent, but it doesn't mean that it is that thing. So the treatment, in case if Osgood Schlatter disease, it's a small brace. It's a patellar strap that helps a bit, especially during the training. And after the training or the match, if the child is playing, applying ice and then anti-inflammatory. This will help. But most likely, if this is not enough, you have to stop from the sports for at least 4 to 6 weeks for the child to be completely without pain, so that he can start again the training slowly and get to the previous levels of playing, so that he is not painful anymore. The good thing of the Osgood Schlatter disease is that when the children, boys in this case, get to 16, the place where the pain is, it gets ossified like adults, and it doesn't give anymore that sort of pain. So sooner or later, it's gonna end up, despite any treatment that it will be given to the child.
All right. And I hope that helps the mom and how to take care of the son. There's another one here saying, I have two questions. First one, I was told my 1-year-old has flat feet can be treated by massaging the feet, or must she go to therapy or go for therapy? Secondly, my feet are very painful when I wake up, but after an hour the pain disappears. Might I be having any problem? And also the inner thighs are very painful. What could be the problem? Probably three questions there. Yeah.
Yeah, I will answer easily to the first two. The third is a bit generic, so it's hard to answer. So almost 50% of the children at the age of 1 have flat feet. So not unless the Achilles tendon, so the heel tendon is short, that is not to be considered a problem. Because if you see one child over 2 at this age has flat feet, so the arch of the foot develops in the first 7 years of life. So you're gonna see a natural improvement. Okay, so there's no scientific paper that has demonstrated that any orthotics like insole and stuff have improvement on that, but there's a lot of business and a lot of push on this, because of course if I can sell you something, I will earn some money for an easy thing, and then you see that the child is walking in a better way because of the insole. So we advise for insole just on children that are consuming the shoes very fast, like in less than a month the outer or the inner part of the shoe is totally gone. So yes, an inner sole with the medial post will help the foot to be put in a better position, so that the shoes they last longer. So this will help definitely. But as long as you remove the insole, the foot becomes flat again. So it's not correcting the flat foot, but we know that flat foot is not a problem per se, not unless it's painful and not unless the Achilles tendon is short. Otherwise, it's a normal variant of a foot that does not need any sort of treatment. So not unless you have those two things, one of the two, then it's a different story. Okay, so most of the flat feet that we see in children, we don't treat at all, and the children are just doing fine, they're not complaining. Okay, so the flat foot is an issue, is that if the child has delayed milestones, so it's an alarm of something else. But if the child is already walking at 1 year, it means that he had normal milestones. Okay, so I won't be worried about it. So the second question was about the pain. So if the pain is located on the heel pad, that's unfortunately one of the most common cause of pain, not working related. It's called plantar fasciitis. It's a very benign thing, but it lasts very, very long. So, and the pain is especially very bad in the morning when you do the first steps. So the treatment for that first is to use like a silicone heel pad. This helps. Anti-inflammatory, I would say it's hard to deliver the anti-inflammatory right there in the plantar fascia. So mostly is the heel pad. There is shockwave therapy that can help directly in that spot where the pain is, and infiltration, like an injection of cortisone, which we very rarely do because it can give rarely can give complications, because it's not an intraarticular injection, so it can be the pigmentation of the skin, and even other issues. And the last resort is to cut the plantar fascia when the pain is unbearable despite all those treatments, at least for 1 year. Yeah.
All right. Thank you. Let's look at another one here. A person who is asking, is it okay to put a mattress on the floor to help ease back pain? Probably this is somebody who has back pain issues, saying, is it okay to put a mattress on the floor to help ease back pain?
So I would rather have an orthopedic mattress rather than putting the mattress on the floor, or I would use a wooden frame with an orthopedic mattress to be feeling better. Of course, it depends on the wealth of the patient, but I would okay, if you have to put it on the floor, at least to be a heavy duty mattress. That's the cheapest solution if you can't afford a wooden frame and an orthopedic mattress, but at least to be a heavy duty. And then every one of us has a different feeling on mattresses. There's someone who likes it very hard, someone likes it medium hard, other just medium soft, very few people. So and some like the memory foam effect, like the last 5 centimeters of the mattress that have the memory foam layer that helps to achieve the form of the body that we usually sleep. They tend to at least fall asleep in the same position rather on one side or on the other, and then this will help. So I would opt rather for an heavy duty mattress or an orthopedic mattress. If you want to put it on the floor because the wooden frame is expensive, I can understand, but the wooden frame is always good, and it gives a very good and nice sensation. Yeah.
Let's look at this one here. Saying, I have had a problem for years. My feet burn and get uncomfortable. It does not pain, but just gets really hot. Sometimes saying it can't even. Let's go back again. I have had a problem for years. My feet burn and get uncomfortable. It does not pain, but just gets really hot.
That might be something related to the vascularity of the foot. If you have an abnormal vascularization of the foot or a blood supply, this is not really related to the foot itself. So I don't know if the patient is suffering venous issues, so that what happens is, if the blood flows goes and stays there on the feet, and it cannot come back because there are some insufficient valves, so that the blood does not come back to the heart, or let's say it stays there for longer, then they can have such a sensation on both feet. And then compression stockinette. I would try first with compression stockinettes to see if this will help the blood flow and this sensation of burn to go away.
All right. There's another one here who is asking, please ask for me. My back pain comes up when I do a lot of hard work, especially washing, doing laundry for long, and basically after an extremely busy day, energy, work involved. So what should I do in such a situation?
Okay, so this depends on the age also of the patient, but I would rather say that when you're working hard, do not exceed on the weight that you are bearing every time. If you have to kind of move objects or food or whatever, this will help already. Some people use during a hard job like a small corset with straps, and it's kind of a lumbar belt. If you've ever seen like those shows like The Greatest Strongman and stuff, they use that when they are putting strength, because that can help especially the lumbar spine to divide a bit the weight all over the lumbar spine and muscle, so it distributes the weight in a more even modality, so that this helps during a heavy duty job. It is not good to have it the whole day, otherwise the lumbar muscles are not used the way they should be used. But during just that heavy part of the job, this corset that usually has 3 or 4 vertical bars in the back will help to distribute the stress on the back and give you less pain. This will definitely help and reduce the kgs that you are holding anytime you have to move something, if possible, of course.
All right. This one here is asking about a pain that they've been living with, saying, I've been living with pain, but at the moment I'm having extreme pains on my waist when I sit for a long time or stand for a long time, and even when walking. What should I do?
So the first step I would say is to understand whether this could come from both hips or from the lower back. So for the hips, the easiest is to take a hip X-ray or an AP pelvis. So just a single film that can tell you at least if there's any arthritis on the hips, and then it will rather need a physical examination to test the movement of the hip, because usually when you have a bit of arthritis, when you flex the hip and you internally rotate it, you feel a sharp pain in the inguinal region, and this is something that can tell you that maybe there's an initial hip arthritis. Otherwise, this pain could be from the back. But physical examination, usually done by an orthopedic surgeon, can help to differentiate between a hip or lower back pain.
And probably one more here before we do a conclusion, saying, I tripped on stairs, dislocated the knee, I hurt the hip and ankle. Knee hurts at times, ankle swells. It seems my foot position changed. What should I do?
Okay, so this could be an issue that might be related to the tibialis posterior tendon that becomes insufficient sometimes, either after a trauma or because it was a bit insufficient before and then it gets worse. That that could be a thing that will lead to a flat foot, but not from someone that had a flat foot before. So it could be like if the tibialis posterior tendon has insufficiency, now the foot can go into a flat foot, so that this can change the actually the arch of the foot. So and usually if it swells medially, so in the area that is on on the ankle, but in the same side of the big toe, just to make it understandable for whoever is listening. So this again, it needs a clinical examination from an orthopedic surgeon to understand what's going on, especially in the foot and ankle, to understand where the problem is, and then examining the mechanical axis. So how are the legs, to understand if also there's an issue on the axis of the knee that is giving such an issue.
Right. Thank you so much, Dr. for those insightful comments regarding the health of our bones. And so as we conclude, you'll give us a bit of a summary regarding the work-related injuries, and then tell us how somebody can get in touch with you at AICQ, and then something special is happening in December. You will let us know.
Okay, so first, I start from the last. We are having one of the most prominent experts in pediatric upper extremities in Europe. It's called Professor Sebastian Farr from Vienna. He's gonna come to Cure from Sunday, 9th of December, to the Friday afterward, to help us in seeing patients with congenital head and upper extremity deformity. So even for the child that they asked before about the deficiency of radius and ulna, we can see him on her during that week. So we are really grateful because he's a very prominent guy, very good and skilled guy that can help during that week many kids. So we're gonna have him in December in Kijabe. So anybody is welcome to see him for consultation from Monday to Friday. Even on Sunday evening, we'll be there to see some patient at Cure Kijabe Hospital. So to see us, so we have clinic in Kijabe every day from Monday to Friday, from 9 to 4, and we are just next to Kijabe Main Hospital. We are around like 1 hour and 15 minutes from Nairobi, and then we have a branch in Nairobi that is in Westlands, West Point Building, Paca Road, 4th floor, nearby Sarit Center. If you Google Cure Nairobi or Cure Kijabe, you can get the number of the reception. They will give you enough information on how to reach there. The Nairobi branch has clinic days on Monday, Wednesdays, and Friday, where you can see one of us, one of our consultant for pediatric orthopedic consultations. And to conclude, work-related issues are very common, and I think if the employer could help the employee with proper ergonomics, that's a big deal in the Western. This will definitely reduce the amount of days that the worker is staying out of the job. It might be a cost at the beginning, but for sure it's going to be much more economic rather than having the worker to stay at home for longer, for especially for back pain or epicondylitis, for especially for the ones that are working at the computer, because it can even get to a point that you are not able to type on the computer because it's so painful. So ergonomic can really help on that. So that's an advice is possible. Help on ergonomic, help for the guys that are working with heavy loads, to reduce those heavy loads, for them to be able to work longer and easier. And then for the people that are transporters, to help also that in ergonomics, especially the seat of the driver to be ergonomically okay, that can be adjusted in height, and then the distance from the steering, the steering, so that they can drive more comfortably. And finally, safety on the road, that is really crucial, I think, in this country, for the people to feel safe on the road, to travel safely, without having so many accidents on the road. Though I think it's becoming better and better, but there's still a long way to go to improve safety on the road.
Thank you so much, Dr. Federico Sibona from AICQ International Kijabe, for your great insights. Looking forward to hosting you soon, or one of your colleagues there, and send our love to them, and have a blessed evening and a blessed weekend ahead.
Thank you so much. It was so nice to be again here, and hope to come back soon. Thank you again.
You're welcome. Well, that's just about it in this hour, where we were hosting